you're suffering from low back pain or leg pain, you might be wondering, could this be a low back disc herniation? And what does that even mean? My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley. And today I'm going to talk about lumbar or low back disc herniations, what they are, what that might look like if you're suffering from one, and what you can do about it. So the low back is made up of 5 vertebrae, this is the lumbar spine, and in between each one of those bones is a disc. And that disc is made up of cartilage. So think of the material that your ear is made of, or your tip of your nose. So not quite as hard as bone, but not quite as soft as muscle. The disc itself is made up of rings of cartilage, and in the middle is a jelly center. Those rings of cartilage can sometimes start to tear, whether it's from one big injury or a series of small injuries. And then if it starts to tear, it can bulge out. And if we're looking down on the spine, here's the disc, here's the back of the spine, and the nerve is really close. So if the disc bulges out, it can sometimes put pressure on the nerve itself. If the tear goes all the way through to the jelly center, that jelly part can start to ooze out and then cause a chemical reaction with the nerve that can be quite painful. Now, how do we know if you're suffering from a lumbar disc herniation? The most definitive way is an MRI or a CT scan. Now that said, there's lots of people walking around with disc herniations and they don't have any pain. So you might have an MRI and you might have more than one disc bulge, but maybe only one of them is painful. Or for some people, it's an incidental finding and they don't have any pain at all. So it's very common. So some people might experience a lot of back pain or a lot of leg pain, or they might have the two together. Sometimes you can have numbness or tingling, either just in the foot or in the pattern of the sciatic nerve, because the bottom disc, the one that is near the L5-S1 nerve, is the most common to bulge out. So if it puts pressure on that nerve, it can cause symptoms of sciatica, so pain down the back of the thigh or into the calf. Sometimes if you have another type of disc bulge, L4, L5, just above that, it can put pressure on the nerve that goes to the side of the leg. So you might have leg pain, you might have numbness and tingling, and you also want to look for foot weakness. Sometimes when that L5 nerve is affected, you can have difficulty bringing the foot up or the toes up when you walk. So you might find that your foot is dropping. So we call that foot drop. And that's something you don't want to leave. You want to make sure that you get attention for that right away, because we don't want that pressure staying on that nerve for too long. So that brings me to, what can you do about it? So you can come see us. We can help definitively diagnose whether or not we think it's a disc bulge, or whether it could be something else, maybe a pinched nerve from a part of your spine, or even pressure from one of your muscles putting pressure on the sciatic nerve. And then we can help you figure out a pain relieving position. So normally as we bend forward, the disc bulges backward, and as we lean backward, the discs get pulled forward. So often for people who have lumbar disc herniations, being in that extension position can be pain relieving, because we know that the most common way for a disc to bulge is to the back and then to the side. So we want to get that disc away from the nerve. You also want to figure out what it is that you're doing in your day that really aggravates your symptoms. So it's normal first thing in the morning for you to be a bit more sore. That's when our discs are full of water, so they're a bit bigger and puffier, so then therefore they're going to put more pressure on the nerve. Also, sitting is a common culprit because of that pressure, and then we tend to slouch around our low back, again bulging that disc backwards. So making sure you have a good setup, whether it's at your computer or in your car, so that you can keep that natural curve in your low back and not put as much pressure on that nerve. You also want to be extra cautious with lifting. So we know that when we bend forward and then we twist, that's the worst case scenario for a disc bulge. That's how we can actually create a disc bulge, and we can definitely aggravate one that's already there. We can treat those really tight muscles that have maybe spasmed to protect you. We can also treat the joints of the spine to make sure that they're moving, not contributing to any of your nerve pain. And we can help calm down the nervous system a little bit in that area so that the pain and the intensity is not so high. We can maybe decrease some of that numbness and tingling or leg pain that you might be experiencing. So not every diagnosis of a lumbar disc herniation means a trip to the surgeon. We want to try conservative care, the type of care that we offer at our office first, and often people can respond to that. If you wanted to book online with us, you can book online at willowbrookchiropractic.com. We also post regular content on YouTube, Instagram, and Facebook. You might be interested in our video about sciatica, or how to set up your workstation or your car, or what to do when you have low back pain. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.